Every child's first steps are a milestone worth celebrating. But for some, that journey looks very different due to a condition that's considered the most common childhood physical disability. That's cerebral palsy, or CP in simple terms. The condition involves movement and postural challenges caused by brain damage, affecting as many as 4 out of every 1,000 children worldwide. Brain damage leading to CP can happen during 3 key periods. That is, before birth, also known as the prenatal stage, during labor or right after birth, and the first few years of life. Unfortunately, cerebral palsy is permanent. There's no cure. But here's the good news. With early interventions, children with CP can have vastly improved outcomes. So, what puts a child at risk? There are a number of factors that can increase the risk of CP depending on when the brain injury occurs. Before birth, premature delivery, low birth weight, maternal malnutrition, or infections can play a role. During labor and delivery, complications like prolonged labor, bleeding, or issues with the baby's oxygen supply can increase the risk. And after birth, things like central nervous system infections like cerebral malaria, low oxygen levels, seizures, or bleeding disorders can be contributing factors. Prematurity and low birth weight stand out as the 2 of the biggest risk factors. The likelihood of CP increases as duration of the pregnancy and birth weight decrease. In most cases, around 75 to 80% are linked to brain injuries before birth, while less than 10% are related to major complications during birth, like oxygen deprivation. Now, what does CP look like? There are different types of cerebral palsy, each with its own challenges. The most common is spastic cerebral palsy, which affects about 80% of children with the condition. It basically involves stiff muscles and awkward movements. Some kids might only have issues in their legs, while others could experience challenges across their entire body, including their arms, trunk, and face. Other forms include dyskinetic cerebral palsy, where children struggle to control their movements. It can range from slow and writhing motions to quick, jerky movements, making everyday tasks like sitting, swallowing, or speaking quite challenging. Then there's ataxic CP, which affects balance and coordination, making walking or fine motor tasks like writing very difficult. Some children even have a combination of types referred to as mixed CP. So, how do you spot CP early? The sooner CP is detected, the better the chances of providing timely support. But spotting it can be tricky since it presents differently in every child. For babies under 6 months old, signs might include poor head control, stiffness, or a limp body. Babies over 6 months might struggle to roll over, sit properly, use their hands, or bring them close to their mouths. By 10 months, unusual crawling patterns like scooting on the bottom or hopping on knees could be red flags. Parents often notice delays in major milestones like rolling over, sitting up, or walking. If you see signs like these, do not wait. Consult a healthcare professional. Early evaluation can make such a big difference. Now, what can be done? While there's no cure for CP, a multidisciplinary approach can significantly improve a child's quality of life. Physiotherapy is often the cornerstone of care, focusing on building strength, mobility, and independence through tailored exercise programs and guidance on posture and assistive devices. Occupational therapy helps kids tackle everyday tasks like dressing, eating, or writing, fostering independence and confidence. Speech therapy is invaluable for children facing challenges with communication. Therapists work on speech clarity, swallowing issues, and even alternative communication methods like sign language or assisted devices. For some children, medications or surgery might be necessary to manage symptoms like severe spasticity and severe joint problems. Every child's journey with CP is unique, but with the right support, they can thrive. It's a journey of resilience and determination, not just for the child and immediate caregiver, but also their entire families. Cerebral palsy isn't just a medical condition, it's a human story. Behind every statistic is a child with dreams, potential, and an incredible spirit. By understanding CP, we can create a more compassionate, supportive world for these little angels and their families. Don't forget to like and share this with anyone who might benefit. Let's spread the word and make a real impact.